You're welcome back to The Pulse. Now, new data from the Ghana Health Service has revealed a shocking nationwide turnout gap, with 7 out of 10 newly posted medical officers failing to report to the assigned regions. The report, dated the 28th of November 2025, shows that out of 463 medical officers allocated across the 16 regions, only 158 have reported, representing just 34% of expected postings. Health Minister Kwabena Mintah-Kando, speaking during government's accountability series, said this.
With respect to the workforce development, out of the 34 billion Ghana cedis, some 16.7 billion has been allocated as compensation. And so we'll continue to pay the 13,500 nurses we put on the payroll this year alone. We are distributing not less than 700 medical doctors across the length and breadth of this country. And His Excellency the President has directed that we send these medical doctors to where they are needed most, especially the districts. I'm sorry to say that we have more than almost 50% of the medical doctors we have in this country in the Greater Accra. And therefore, let me take this opportunity to appeal to the medical officers we are posting here at the moment, not to see this policy as punishment, but as an attempt for equitable distribution of the workforce we have in this country. And of course, government will also be seeking to create that congenial atmosphere for you to deliver your work. That notwithstanding, we have paid some 500 million Ghana cedis for the nursing trainee allowance. And first week in December, we are going to pay 231 million Ghana cedis again. So we are not piling up arrears. We are paying promptly the nursing trainee allowances.
We have Rafiq Salam from the Upper West region, where we have a very low turnout of medical officers reporting to their stations since they were posted. Rafiq, thank you for your time this afternoon. Is the picture any different in the Upper West region? Hello, Rafiq. Unfortunately, we've lost Rafiq Salam there, but the picture, as I mentioned earlier, is very bleak. In about 3 regions, we have 0% reporting to their posts since they were posted to those regions. And you have a region like the Greater Accra region with the highest percentage of persons reporting. About 80% of individuals posted to the various health centers in the Greater Accra region have reported. In the Ashanti region, we have about 72 or 76% of persons reporting for work there. They are the 2 highest regions with the highest percentage of medical officers reporting to work. And we'll bring you more on that later and try to connect with Rafiq Salam in the Upper West region there, where we understand that the rate is very low. Rafiq, I understand I have you back on the line. Paint a picture in the Upper West region. Are medical officers reporting to work, those that have newly been posted?
As I report to you now, Kenneth, that the Upper West region was allocated.
Hello, Rafiq.
To come to the region to work.
Rafiq, sorry, we lost you along the line. Can you kindly repeat yourself?
I am saying that the Upper West region was allocated 32 slots. Are you hearing me?
Yes, I can.
Okay, 32 slots. Upper West region was allocated 32 slots. Out of this number, 30 of them accepted the posting to come to the Upper West region. And then out of this number, 25 of them, as we speak now, have not reported. But the information that we also gleaned on also indicated that 5 of them are also pursuing some special course at Conformity Teaching Hospital and other areas. And so that is what is happening in the region. And so the people of the region are not really happy about the the medical doctors that have refused postings to the region. Because when you look at the Upper West region, we are talking about a region with a population of a little over 900,000. That's what is really happening. But out of this number, they've gotten about 82 doctors in this region. Only 82 doctors are in this region. But as you speak now, out of these 82 doctors, majority of them are at the regional Upper West Regional Hospital. And then also a greater number of them are also doing some specialty courses. So in all, we have only 55 active medical doctors in the region taking care of over 900,000 people. And so the picture in the Upper West region is not the best. And the medical director and also the people, residents in the region are not really happy about the way things pan out.
And how is that impacting healthcare service in the Upper West region, Rafiq?
This is a young region, Lisa, though we are also older than some regions. But I can tell you is that, the World Health Organization ratio for doctors has to deal with 1 doctor to 1,000 people. As we speak now, the Upper West region ratio is higher because I'm talking about 8.
Unfortunately,
2 doctors in the region taking care of over some districts in the region. They don't have a single medical doctor. They don't have a single medical doctor in those facilities. And so.
Hello, Rafiq.
It's going to have a lot of a negative impact on. Hello?
I can hear you, Rafiq.
Okay, so that's the situation. So the situation is going to have a negative impact in the region.
Right. Rafiq Salam there from Wa in the Upper West region. Thank you very much. Rafiq is reporting that the situation there is very bleak. But in neighboring Upper East region, we understand that not a single doctor has reported to post, at least per what the health minister told us yesterday, has yet to report to post. Not a single one of them. Well, let's still stay on health because health authorities in the Ashanti region are worried over the failure of people suspected to be living with HIV to seek treatment. Though the UN AIDS is projecting 63,159 people could be living with HIV in the Ashanti region, only about 33,000, representing 52%, know their status and are on treatment, with a whopping 29,960 nowhere to be found. Ashanti Regional Director of the Ghana Health Service, Dr. Fred Adomako-Boateng, observes the gap is a significant public health risk to all. Ohimi Teria reports from the region.
Ashanti region saw an improvement in persons living with HIV on treatment from 25,891 in 2024 to 33,199 in 2025. This represents a 28.2% increase over the period. The region also saw 6,293 new clients on treatment as compared to 5,201 over the same period last year. Ashanti Regional Director of the Ghana Health Services, Dr. Fred Adomako-Boateng, who attributes the gains to the dedication of healthcare workers and stakeholders, say there is more work to be done, describing it as a public health risk. He is worried that a whopping 29,960 of the estimated HIV population in the region either do not know their HIV status or are not on medication. Dr. Adomako-Boateng insists the only way to correct the gap is through improved testing, an increase in awareness, and making prevention services easily accessible.
We have recorded meaningful gains. As of November 2025, our clients on treatment, which we call COT, stands at 32,199, an increase from 25,891 in December 2024. And this represents a 28.2% rise. We also enrolled 6,293 new clients into treatment, compared to 5,201 in the same period last year. However, we must confront the reality. Out of the estimated HIV population of 63,159 in Ashanti region that are supposed to be on treatment, we have only 33,199 on treatment, representing 52.9% of those who are supposed to be on treatment. Approximately 29,960 individuals either do not know their status or are not on medication. And this gap poses a significant public health risk.
Percy Kuranche, who has been living with HIV for the past 35 years, told a World AIDS Day commemoration event that stigma, especially in the media, is still high. He wants Ghanaians to freely test to know their status to protect lives.
Living with HIV for almost 35 years now, and I'm on medication. So I advise all my people who have been tested positive to go for their drugs, take their medication well, and they will live strong as I am. And the people who have not yet tested should also go and test and know their status so that they can also stand firm and then continue with their medication.
Meanwhile, Dr. Admako Boateng wants the youth to take advantage of PrEP, a safe daily medication that reduces the chance of getting HIV by more than 90%. From Kumasi, for Joy News, Ohime Teria reporting.
Meanwhile, the Ghana AIDS Commission, or Ghana, marks World AIDS Day 2025 under the shadow of rising HIV cases, with 334,721 people now living with the virus. That is 68% of them being women. New infections remain worryingly high at an average of 42 a day, and gaps in testing and treatment persist, underscoring the urgent need for stronger prevention and care. Addressing a press conference earlier, Dr. Emmanuel Tevio, who is the programs manager of the National AIDS STI Control Program, stressed that Ghana must significantly step up public education to curb the spread.
34,721 people are living with HIV in Ghana. Out of this, 229,261 are female and 105,460 male. Now, 15,290 new infections were recorded in 2024, and 12,614 AIDS-related deaths in 2024 as well. Now, we have 42 new infections which occur every single day. That's a translation of this. And 67% of the new infections are among females, and children constitute 5.4% of people living with HIV/AIDS, which translates into 18,229 infections for children. Now, Ghana has what we call the generalized epidemic, with a prevalence of 1.49%. Now, these numbers represent our mothers, fathers, daughters, sisters, brothers, and friends. They highlight the urgent need for collective action in the national response in the fight against HIV/AIDS. Ghana's current performance on the UNAIDS 95-95-95 targets reveals significant gaps. Currently, we stand at 68, 69, and 90. So what that means is that only 68% of people living with HIV know their status, and the target is supposed to be 95%. And 69% of those diagnosed are on antiretroviral therapy. The target there too should be 95%. And 90% of those on ART, that's antiretroviral therapy, have achieved viral suppression. And that one to the target should be 95%. Now, let's examine some critical challenges. Now, one, women represent 68%, about 68.5% of people living with HIV, highlighting urgent need for women-centered prevention and care. So there is a feminization crisis in that respect. Now, the youth are also vulnerable. Young people remain disproportionately affected, with many unaware of their status. The first 295s, which are our greatest challenges, lie in testing and treatment initiation, and not treatment effectiveness.
Well, let's get some fresh perspective on this situation. And joining me on Zoom right now is the programs manager of the National AIDS STI Control Programs, Dr. Emmanuel Tevio. Thank you for your time this evening. Of course, the issue about funding has become very critical, especially when the U.S. cut funding for HIV through the USAID and others. How really is this affecting the treatment of HIV in Ghana? Hello, Dr. Tevio, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can hear you. I was asking about the preventive measures and, how to curb HIV. We know that it has been truncated by the cutting of aid to, help curb the situation. And really, how has that affected the HIV preventive measures that you want to put in place?
Yes, thank you very much. And good afternoon, good evening to our precious listeners. Yes, I think that the funding landscape generally has changed globally. And of course, it has been challenging for HIV response everywhere. In Ghana is not an exception. However, we at the national program have had some commitment from government to fill in the gap and also to make sure that we continue to render these life-saving services to our people. And so though we have had challenges, I think that government has done very well. They have been able to provide us with the commodities that we need to test. They've been able to support in procuring antiretroviral therapy drugs for people living with HIV. And there are even discussions on how to start using new tools, which are also for prevention, like the long-acting lenacapavir, which is now the new kid on the block to help us improve on our prevention aspect of the response. So I think that it's not too bad. I think it's challenging, but it's not too bad. We still have some support from government and also from Global Fund, who were also affected by the funding cuts, but they have done some reprioritization, and that is helping us to be able to meet the needs of our response.
And how accessible are these preventive drugs you mentioned?
Yeah, so already we have in place these preventive drugs. We call them PrEP. And of course, for now, what we are doing is that is for some targeted high-risk groups in our communities who need them really. Not everybody needs them. So we have a way of assessing people who need them, and then we are able to give it to them. So they are accessible at our facilities where do the assessment and we can link them to care.
And who are these groups that need them critically?
So we usually have the vulnerable population, the key population. Then we also have, sometimes you can have a couple in which one of them is positive and the other one is negative.
Right.
But you can give them this medication so that it will continue to protect the one who is negative to remain negative. Also.
Hello, Dr. Tevio.
We also benefit from such.
Over 300,000 persons living with HIV in Ghana. That's about 1% of our population. Really, usually the concern is that people are even shy to go to
at least when
the hospitals to ensure that they get treatment or they get tested for HIV. Are there any measures in place to make HIV testing accessible to people rather than walking to the hospital? Unfortunately, we've lost Dr. Emmanuel.
Yes, I lost you a bit on that question.
Yes, I was saying that a lot of people are even shy to go to health centers to get tested for
yes,
HIV,
yes.
and this could mean that there are more people who have HIV and are not even aware. Going forward, are there any measures to make HIV testing more accessible to people rather than going to health facilities where people shy away from going?
That's correct. You are spot on. And one of the reasons is because of the stigma and discrimination that is pervasive in the country. And that is preventing people from, coming. So now we have what we call the HIV self-test kits. This is currently in the country, and we are running it with one of our civil society organizations called Garnet.
Okay.
Where you can sit in the comfort of your room and test yourself to check whether you have HIV/AIDS. And when you are positive, there is a contact number that you can call, and then you get support and be linked to care, and your confidentiality is assured and all that. So this is something that we are pursuing very aggressively. And the coming years, we are going to make sure that this is scaled up to the whole country to make sure that it's available for everybody to be able to use.
So as we speak now, the limited ones that are in the country, how do people assess them? Are they for sale? Which points can they get them?
So no, so they are not for sale. They are available, as I said. Garnet is we are partnering with Garnet to implement it at the community level. So you have it at the, over the country, all over the country at the district, community level and all that. The officers are there and the access there. And sometimes when we have activities, we do share these test kits to the general population. It's available everywhere and it's for free. It's not for sale, it's for free as a program. We have it for free and it's available.
The funding for HIV prevention, as you mentioned earlier, has really changed, not only in Ghana, around the globe. Are you looking at other sources of funding to help, cure HIV or not cure HIV, prevent HIV and suppress the virus from spreading?
At so many ways of funding it. As I told you, government has made a commitment. So we are also looking at domestic funding avenues. We are excited that government has uncapped the National Health Insurance scheme, and so it has made more funding available.
Okay.
And there are discussions that there's a possibility that this can also be made available for people with HIV/AIDS to be able to take care of some of their needs at the facility level. And then also we continue to engage, other partners who are also willing to partner with us, and even looking at internally social responsibility by companies, these extractive companies and all that. These are all have been to get this funding support.
Right. Dr. Emmanuel Tevio, thank you very much for joining us this afternoon. Well, let's bring in more stories because the Minister for Gender and Social Protection, Agnes Na Momolate, says government is implementing measures to curb HIV transmission from pregnant women to their babies amid rising HIV/AIDS prevalence in the country. Speaking at the launch of the Civil Society Strengthening Program Strategy in Accra, she noted that government is particularly focused on supporting pregnant women living with HIV/AIDS. Edna Garimer's report, read to you.
About 1.3 million women and girls with HIV become pregnant each year, with a 15 to 45% risk of mother-to-child transmission without intervention. A study in Ghana shows MTCT is the second leading mode of HIV transmission, accounting for nearly all cases in children under 15. Speaking at the launch in Accra, the Minister of Gender, Children and Social Protection, Agnes Na Momolate, underscored the government's resolve to invest in efforts that reduce HIV transmission among pregnant women and their babies.
We are looking at reducing mother-to-child transmission, which we have chalked some successes. We still have a long way to go. If for anything at all, we know that once somebody contracts it, it's not a death sentence. There is hope, but we don't want mothers to transmit to the children.
She also stated the government's commitment to support an effort to shift power locally.
So this is just reaffirming that our partnership is so significant going forward, especially if you want to shift power, where you want to move it from the central to the local level so that local actors can own the impact of every intervention. They are not only beneficiaries.
On her part, head of programs at Star Ghana Foundation, Eunice Agbe Nyaji, provided further insight into the importance of shifting power.
Shifting power and decision-making and control from funders and institutions who are based in Global North to civil society and communities. And this is to ensure that development priorities are set by communities because they live challenges, and they are best placed to determine how those development agendas, development collaboration should be done.
The Shifting the Power program is an 8-year initiative led by Star Ghana Foundation, the West Africa Civil Society Institute, and Tillytones Foundation, with support from Comic Relief and the Foreign Commonwealth and Development Office. Edna Garima's report read to you.